levels. Well, good afternoon. We appreciate everyone joining us this afternoon so we can give everyone an update following the weekend. And obviously we hope that everyone had a good weekend, as good can be expected under our new norms. On Friday, I challenged Granite Staters to the Home Hike Challenge, to find a hiking or walking trail off the beaten path and away from the crowds. And I just wanted to report that the response was actually quite amazing, just to see a lot of the stories on social media, a lot of the families reaching out, telling about their individual stories of kind of keeping it local. And again, all supporting that concept that you are healthier at home, you're healthier the closer you can be at home. But if you do have to go outside for exercise and fresh air, and we want to encourage that when necessary, to keep it local and to stay away from the crowds as much as possible. The people in New Hampshire did a great job finding those exercise opportunities on their own in their quiet little area of New Hampshire. And again, it's all about really, I think, reinforcing smart and responsible behavior. The thinking behind the Home Hike Challenge was to avoid those major hiking areas where many folks from out of state have been going. And as I've repeatedly stated, no governor can close down the border. We cannot do that under the Constitution, but we can take steps to discourage out-of-staters from overrunning our systems. Today I am announcing, after hearing the concerns of hotel operators, from citizens alike, that effective immediately, all hotels and short-term rentals like Airbnbs must suspend lodging accommodations for non-essential reasons like vacations and other leisurely purposes. Hotels and other lodging establishments will still be able to provide accommodations, to provide housing for essential healthcare workers, first responders, state-approved quarantining accommodations for individuals, and the victims of domestic and sexual violence. Guests currently staying in hotels or Airbnbs, they may stay through the end date of the reservation before returning home. But we can't emphasize it enough. People are healthier in your own home and in your home state. We look forward to welcoming you back into New Hampshire when this public crisis is abated. And as we continue to fight the COVID-19 crisis, securing personal protective equipment remains a top priority for healthcare facilities and the state of New Hampshire. To date, the state has acquired over 300,000 individual pieces of PPE, everything from N95 masks, gowns, booties, gloves, masks. And as I've said, up until last month, the state was not really in the PPE business, but we have worked around the clock to backstop this critical equipment for our healthcare workers and our first responders on the front lines of the crisis. To date, we're not aware of any healthcare facility that has no PPE. We're working hard to fulfill their requests, but it's important to highlight that no facility has gone without any equipment as they work to combat the COVID-19 crisis. We've also seen inspiring stories from those in the private sector who have shifted their manufacturing to produce PPE or donating or procuring PPE from the commercial marketplace. And I'd like to thank those individuals and those businesses for not just helping out, but being a driving force in this effort. It is truly an opportunity for the entire team of New Hampshire to come together to combat the crisis and put every resource we have available on the front lines. With that, I want to turn it over to Commissioner Lori Shibinette, who will provide a synopsis of our healthcare worker exposure and testing. Commissioner.
Thank you, Governor. The front line of the COVID-19 crisis is in our healthcare workforce. From our thousands of nurses caring for our patients every day, our environmental service workers that sanitize every inch of our healthcare facilities, and to our home health aides that help keep our vulnerable populations at home. Approximately 192, or 26%, healthcare workers in New Hampshire have tested positive for COVID-19 since our first cases in New Hampshire. Those healthcare workers include everyone from physicians to environmental service workers. This includes healthcare workers that have differing risk factors, including international travel, close contact with someone that had COVID, or exposure in the workplace. We have engaged our healthcare partners to expedite testing, including our partner hospitals, Convenient MD, and our MMRS mobile testing team. If an employer that does not do COVID-19 testing needs to have a healthcare worker tested, they can have all specimens sent to the public health lab that has a turnover rate of hours rather than days. Today we were notified that our state will be allocated 15 of the new Abbott ID tests what that means is Abbott ID testing is a new machine that allows results of COVID-19 testing in about 5 minutes. That testing device is going to change how we respond to this virus in our state. It's going to help us keep our citizens safe. It's going to help us keep our healthcare workforce safe. So with that, I'm going to turn it over to Dr. Ben Chan to give us a general update.
Great. Good afternoon. Thank you, Commissioner. Thank you, Governor. So we are up to about 1.3 million cases of COVID-19 worldwide. That includes close to 350,000 cases in the United States. And we are seeing increasing numbers of cases globally and in the U.S. On a daily basis. In New Hampshire, we are reporting a total of 715 people with COVID-19. In New Hampshire residents, this is an increase of about 46 people from what we reported yesterday. Over the last week or so, we've seen on average about 50 individuals per day confirmed with COVID-19. Out of these 715 individuals with diagnosed COVID-19, 103 people, or about 14%, have required hospitalization from their illness, and there are 9 individuals, or approximately 1%, who have died as a result of COVID-19. All of these deaths have been in individuals who are of an older age or have chronic medical conditions, which is exactly the higher risk population that we need to protect from spread of COVID-19. I do want to mention that the 715 individuals 715 individuals diagnosed with COVID-19 are only a smaller percentage of the overall burden of infection in New Hampshire. Not everybody with symptoms of COVID-19 currently is being tested. We are working to certainly increase testing capacity, but healthcare providers may appropriately recommend that people with signs and symptoms of COVID-19 who are not otherwise in need of emergent medical attention can and should oftentimes be managed at home and isolated at home so that they are not exposing other people in their community. But at this point, we consider COVID-19 to be widespread and present in most areas of our state, and so it's important for everybody to continue to take the social distancing measures that we have talked about before to prevent spread of COVID-19 in our communities and protect those who are most vulnerable, individuals who are of an older age, people 60 years of age and older, people with chronic medical conditions, or people whose immune system may not be working properly. These are the individuals that we need to particularly protect, because if they become infected with COVID-19, they could have more serious complications of disease. I do want to briefly mention the new voluntary recommendation that was put out by the Centers for Disease Control and Prevention on Friday about cloth mask use. The CDC has recommended that people in the community can voluntarily use cloth masks when they are out in public and not able to maintain social distancing. For example, if someone is going to a grocery store or a doctor's office, cloth masks can be used. I do want to highlight, though, that cloth masks for this purpose are intended to protect others from the wearer of the mask. Right? A cloth mask is not primarily intended as personal protective equipment for the person wearing the mask. There's very limited evidence of cloth masks protecting the person wearing it. But because we now know that COVID-19 can be spread in a significant proportion of people, in the possibly days before they develop symptoms, people can shed this virus from their respiratory tract and transmit it to other people, even when not showing symptoms of COVID-19. And for that reason, the Centers for Disease Control and Prevention has provided this recommendation, voluntary recommendation, that people can wear cloth masks when in public to protect other people in the event that they may be asymptomatically shedding the virus. The primary way, however, for people to protect themselves and others in their communities is still social distancing. And so even though we have this new recommendation from the Centers for Disease Control and Prevention, it's important for everybody in our communities to still stay home as much as possible. Certainly if people need to go out urgently for essential supplies or for a healthcare provider visit, we want people to be able to do so. But it's important for people to continue to stay at home as much as possible, and when they are out, to keep a safe distance from others of at least 6 feet. That's what we mean by social distancing. It's also critically important that people continue to practice good hand hygiene and people avoid touching, for example, their eyes, their nose, and their mouth, especially with unclean or unwashed hands, which is a potential mode of infection being transmitted from a surface that somebody might touch and then touch their eyes, nose, or mouth. This is particularly important if people are out wearing cloth masks in public. Having something on your face we know can potentially drive people to be touching their face or fidgeting with their hands more. So we want to give a cautionary word that if people are wearing cloth masks when they're out in public, they need to continue to pay close attention to good hand hygiene and avoid touching their eyes, nose, and mouth to not only protect themselves from infection, but also to prevent then spreading potential infection to other people in the community. So with that said, again, I want to encourage people to maintain social distancing when they're out and about. If people have cloth masks, they can wear them when out in public, but that's still the primary way to protect others and prevent the spread of COVID-19 is through social distancing. If people are looking for cloth masks, I would point you to the Centers for Disease Control and Prevention website, which has instructions on how people can make their own cloth masks and how they can wear them properly. Thank you very much.
Thank you, Dr. Chan. With that, I guess we can just open it right up for questions if folks have any questions.
Governor, the Navy has reported that a civilian employee at Portsmouth Naval Shipyard has died from complications from the coronavirus. Had you learned this, and could you comment a little bit about the safety and security for the folks out there doing such?
Specifically to, so the question is revolves around an individual who has reportedly passed away from the coronavirus over at the Portsmouth Naval Shipyard. So I was made aware that there was an individual that had been, I believe, hospitalized when this came up earlier last week. So, I mean, we can't divulge the residence or anything like that of that individual, of course. But I think it goes to a bigger concern and issue around any facility with large populations, right? I mean, there's a large population at the Portsmouth Shipyard. It doesn't necessarily mean that we need to shut down the Portsmouth Naval Shipyard, but we do have to take these new physical and social distancing precautions very, very seriously, not just in our homes and our communities, but in our workplace. And hats off to a lot of manufacturers and some of our larger manufacturers especially, I think, who have instituted a variety of different measures to hopefully keep their employees safe. And if somebody were, unfortunately, to come down positive with COVID, hopefully it doesn't spread and infect others, or even force a quarantine of a large portions of those employers. So for those essential employers that are up and running, again, if they haven't already, we encourage everyone to take smart precautions to ensure that if there is one positive case, it does not turn to an outbreak that can have devastating effects across the entire population within those organizations.
We know healthcare workers are at high risk, and I want to ask this of the Governor and the Commissioner as well, since you talked about the testing and those new machines. With healthcare workers, the numbers look okay right now for the rate of infection that they're facing and the numbers that we need of them in our hospitals and healthcare facilities. Are we going to be able to maintain that workforce through this entire?
Sure. So I'm going to answer the second part first, and then I'll ask the Commissioner to come up. When it comes to the actual need and the management of the healthcare workforce that we're going to need on the front lines, I'd refer back to the new system we've put into place, two of them actually, over the past couple of weeks. One is simply the volunteer system. You have retired healthcare workers, nurses, doctors coming out of the woodwork, hundreds of them actually signing up at the NH Responds website so that we'll be able to utilize them on a voluntary basis. We also have a healthcare workforce management system being managed by the Department of Employment Security for any healthcare workers that might be furloughed temporarily. We can actually potentially use them and manage them around the state from one facility to another. We're waiving the licensing and the licensing and certification process for those individuals to allow them to move around the state into different facilities. I defer to the Commissioner a little bit on the actual numbers.
Hi, Adam. I'm going to have you repeat your question.
Yeah, so I'm just curious, with the number and the rate of infection you're seeing among healthcare workers right now, the nurses, the doctors, do you worry at all that we'll be able to have enough doctors and nurses through the entire process over the next month and a half?
I worry every day about that, for sure. You know, even one healthcare exposure is too many. a lot of our healthcare workforce that have been exposed are exposed in different ways, right? We track people that are healthcare workers based on that classification, but those same people, although are at high risk of exposure through their workplace, they've also been exposed by traveling overseas or by having a household family member that may have been positive for COVID. So yes, we are concerned that we may not have enough in every region of the state at the time when there is a surge. But what we do have is a system to make sure that we redeploy people to the areas in the most need. So we don't expect that the entire state hit peak at the same time, just the makeup of the state. We have our very populated areas, and then we have our rural areas. So being able to redeploy a nurse from a rural area that's not having surge down into Manchester or Nashua or over in Portsmouth is a really important part of our plan. But we're watching the numbers, and we're watching how the virus is spreading in our community and how it's impacting our workforce. So we have so many irons in the fire, so to say. One of the other things we've done is engage the schools. So how can we get fourth-year nursing students or second-year nursing students, get them out in some of the surge centers, or getting them licensed as a graduate nurse so they can be on the front lines. So we probably have 5 or 6 different programs right now to try to supplement that workforce.
Governor, are you comfortable with where we are currently with PPE, and talk about what the state is doing to make sure that we have enough?
Sure. So the question is, are we comfortable where we are with PPE? Today, we're comfortable where we are, but we need more. There's no doubt about it. Again, we've received 3 significant shipments from the federal government. We've been able to get the vast majority of that out to the healthcare providers that have requested it, and literally hundreds of them across the state, as well as first responders, a lot of first responder organizations as well. We've been able to provide masks and gowns and booties. We've held a little bit of that back, a very small portion, because we don't know if there's, during the surge, if there's going to be a very critical need on a moment's notice. Maybe it's in a long-term care facility or something of that nature. We have more commercial purchases coming in, not just from the state, but also from our commercial partners, right? We heard the story of SoClean last week and donating literally potentially hundreds of thousands, a couple 100,000 masks over the next couple of weeks. We have other commercial purchases, not just within the country, but even from overseas that we're hoping come to fruition. Those are the types of purchases and supplies that look like they're going to happen, but I'm not going to count on it until I actually see it land in the state of New Hampshire, because we've heard stories of shipments getting diverted. So we really have all the irons in the fire. The hardest part here is, again, the state has kind of been thrown into being the backstop of PPE for all the different healthcare organizations of the state. Not something that we normally do, but I got to tell you, I think the team has done very well, considering the fact that every hospital, every healthcare facility, every municipal and state and country government on the planet is fighting for the exact same resources. I mean, think about that. Everyone is fighting for the exact same resources with the exact same manufacturers, so the competition is absolutely unprecedented. So understanding that, I think we've actually done fairly well as a small state of New Hampshire, being able to kind of get our requests out there, our purchases out there. We're comfortable where we are today. Don't know exactly where the surge is going to be, and hopefully later in the week we'll talk a little more about our modeling, where we see the surge, what the numbers will potentially look like. And based on that model determines really what we think our true need of PPE will be. The second issue I'd like to bring up is just the fact that we think we're going to get through this. We really are in the next couple months. You never know what's going to happen with another surge or another surge or another surge. So what we're already doing now is planning long term in terms of what else can the state be doing to make sure that we're not in this position again, right? We don't want to just be relying on the federal government. Are there stockpiles that we can build here? Can we get some of these manufacturers who have stepped up into more of a long-term rapid response agreement with the state, so we can turn it around and get anything from PPE to ventilators, whatever equipment might be necessary, not just for the COVID-19 pandemic, but for the next one. We don't know what the next one will look like, but we've already started planning ahead, not just for this coming surge, but whatever might lie in months and years ahead, frankly. So there's a lot of opportunity there. It's been a bit of a learning curve, to be sure, for a lot of us, but the state has handled it very, very well.
How confident are you that the state healthcare system, as it's currently configured, will get through this? Obviously, last week you announced the first disbursement out of this hospital fund to the against that $50 million far exceed the $50 million number. You know, where are we headed on
Sure.
that?
So the question really relies, or is really asking, where are we headed in terms of both this crisis and long term, I think, in terms of the security of our healthcare system to manage the crisis today and for the long term. I feel very confident in the healthcare system today to manage the crisis of today, without a doubt. I think not just in New Hampshire, but across the country, you're going to see a massive shakeup of the healthcare system. In some ways, I think it'll be a very good thing, right? I think there'll be broader, hopefully broader access to things like telemedicine, right? Maybe a more faster track to pharmaceuticals or getting approval at the federal level, whether it be the FDA or from FEMA or whatever it might be. We want to get that fast track approval that currently has to happen at the federal level so states can implement and operationalize these opportunities very, very quickly. The cost models, I think, are one of the biggest concerns we had to create. And again, New Hampshire was one of the first states, I think the first state, to create the hospital fund with $50 million to make sure that no one's going to shut down their doors. We've already put out some of those dollars. We'll be putting out more again this week, again, just to give the citizens the security that those doors will be open. But what do those cost models really look like? Whether you're talking about Medicaid, whether you're talking about the insurance model, whether you're talking about a cost model in a pandemic situation like this, by, I think, exploring the innovative opportunities, I think, brings those cost models into line with something that's manageable. But how this all shakes out will undoubtedly change the healthcare model in this entire country. And I think it could be a very positive thing in that it will hopefully open up the opportunity for more innovation and more rapid response for the individual's needs.
But in the near term, is it reasonable to expect that other healthcare facilities will be furloughing half their employees, hundreds of jobs?
Sure. So the question is, in the near term, is it expected that other healthcare facilities may be furloughing employees? Yes, I think that's very possible. Remember, a lot of that is because some of these healthcare facilities are almost empty right now, right? They've really emptied out their beds. They've emptied out their hallways. Elective surgeries are way, way down. Only really urgent elective procedures are happening across the state. Individuals are deciding, I might not want to go in, and risk getting infected with COVID. So individuals are making the choice to not walk in those doors as much as well. That will all normalize out in the long run, but without a doubt, in the short term, it could provide some financial hardship in both the state government as well as the federal government, the federal $100 billion fund that has been created, which we strongly encourage a lot of the hospitals and healthcare providers to apply into, will be able to provide some long-term financial security for those organizations as well. Yes, sir.
Thank you. So you very early in this made some orders concerning renters not being evicted, and
Yes.
people not being foreclosed on, and then followed that up with, hey, pay your bills, don't not pay your
Right.
bills, right? That was great. However, we have about 18, according to last year's data, we have about 1,800 people who are living in various states of non-confirmed living situations, either in shelters, camping. Some of them are living in transitional motels and things like that. What's the plan to deal with homeless in the state?
So the question is, what's the plan to deal with homeless in the state as it pertains to the COVID crisis, I assume? So
They're a drain on police, in the case of Concord, the police are constantly dealing with the issue.
Sure. So I think there's really, if I may, there's two questions there, I think. What is the long-term plan with, the homelessness issue in the state, a discussion that has been going on. And again, I think we've made some real strides there well prior to the COVID crisis hitting New Hampshire. We're making a lot of good strides there, working with not just cities and towns and local organizations, nonprofit groups, to make sure that we have the capacity to deal with not just the homeless issue, but the co-occurring issues that can come with homelessness. In terms of the COVID crisis and the pandemic crisis that we're dealing with today, we have established a model that allows for folks within the homeless population to still maintain a quarantine status. We have separate locations for homeless and for them to be quarantined. And as well as some of the positive cases that might come in as well. Long term, we definitely have to get back to understanding where the homelessness issue was before this crisis and what it's going to look like after. I don't think anybody knows that, unfortunately. So we're constantly, right now our shelters are pretty much full. They're pretty much at capacity. So we'll have to be monitoring that through the crisis, but also looking at that data and planning ahead to see where this is going to take us. Are we going to be in a better or worse position than we were than at the start of it? Where my guess is we're going to be in a much tougher situation, to be sure. Now, there's a lot of opportunity with the federal funds that are going to come down, the relief funds, maybe even stimulus funds. We we don't know what those will look like. But the relief funds coming down, whether they're part of the community development block grants, direct funds out of Health and Human Services. We were working very closely with Senator Shaheen and Senator Hassan's office. They did, I thought, a very good summary of some of the financial opportunities from the federal government above and beyond the $1.25 billion that the state will bring in, where they broke it down, were able to break it down and identify some of the opportunities on law enforcement. You bring up that a lot of these services can be a drain on law enforcement if you don't have the other services available. You ask your law enforcement officers on the front lines to basically become everything from recovery specialists, mental health specialists, and all of this sort of thing. So I think by having a variety of these federal funds, and I mean they've already identified another about $160 million over and above the $1.25 billion the state's going to have for relief efforts for a variety of these different local programs. I mean, millions of dollars will undoubtedly go into Manchester or Nashua or some of the bigger areas, and hopefully those funds, we're looking at it now, but we believe those funds should have some flexibility to be sure. A lot of funds also on the education side, and that's important because such a large part of a municipality's costs are on education. So the more that the federal government can help support some of the education needs, education stabilization grants, that helps free up a lot more of the other dollars within those municipal budgets to help work with problems like the homelessness issue. We don't know what that model is going to look like long term, but it's something that we're going to be right on top of, to be sure. Sure.
Can I ask one more? So you have a situation where a prison guard was tested positive
Yes.
recently. You also have had a number of concerns raised about a convicted felon, it looks like, with a threat case being released from Carroll County. And this weekend, there were two officer-involved shootings with two perpetrators.
Yes.
One who was accused of firebombing his ex's house. What are your thoughts about public safety in the realm of judges and people, advocates, wanting to release what seems like pretty dangerous people on very short
Sure.
terms and releasing them based on potential infection?
Sure. So the question really revolves around the general issue of public safety through this pandemic, as well as some of the issues we've seen just in the past 48 to 72 hours with what we understand as individuals actually being released. So let's just talk about public safety as a whole for a moment. When you're in a pandemic situation, when you're in a situation with a lot of massive amounts of economic instability, that is a recipe for situations on the front lines of law enforcement and public safety that have to be, we have to make sure that we are right there behind them, whether it's at a local level or a state level. We have incredible partnerships within this state that were built for the past 2 or 3 years really, between local and state law enforcement, making sure the communication is there, working with our emergency operations center all the way up and down the line. So whether it's new funds coming in, making sure that folks on the front lines of law enforcement have what they need, making sure that folks on the front lines of law enforcement that may be coming in contact with potentially positive COVID cases, they then enter into a quarantine situation or a situation that has to be tested. This all wraps back into the idea of having some of these rapid response tests on hand so we can get those frontline workers back onto the front lines where we need them to be, as opposed to being quarantined for weeks on end. Those are all going to be very important tools as we go forward in the crisis. Specific to your question pertaining to, it's my understanding that a judge did let an individual out with a history of domestic violence. I can tell you that my administration has no part in that at all. That is a decision solely taken by that judge. I don't know the specifics of the situation, but I can tell you it's concerning, without a doubt. We want to make sure that this isn't a pattern. You would hope that judge used the best judgment in that call, but on the surface of it, it's very alarming, without a doubt. We had an issue of a jail, again a county jail, that it does not come under the purview of this office, letting an individual out. That's the purview of that jail, and again, it's alarming. It's very, very concerning, and so we want to again push out the message that public safety has to be paramount in this. I understand that they're looking at other factors as well, but not even knowing exactly how exacerbated this problem is going to be in the next few weeks. You need to be buckled down, disciplined, ready for anything, and I get very concerned over any practices of that nature that can then create almost a pattern. Right? You don't want a pattern of this type of thing where you're letting folks out. So again, nothing that our administration took part in, but we just hope that people are using the best judgment when making these very difficult calls.
Is it problematic that Manchester had to close its drive-through
So the drive-up testing site in Manchester, the opportunity that was created there was Convenient MD was stepping up, doing a lot of the testing. Elliott Hospital and I think even Catholic Medical was doing a lot of the sampling and testing. And so the discussions between the Emergency Operations Center and Chief Goonan, who's the Chief Public Safety Officer in the city of Manchester, it was agreed that, that time was right to kind of reutilize some of those assets in different areas. So by no means is Manchester lacking in testing because of that. It's just that other organizations on the private side were able to step up, get some of the supplies that they needed to do the sampling and the testing. I'm sorry, Kevin. Sorry. I'll come right back to you. Thanks.
What's being done to ensure that home health care workers who are employed by private companies in the state are supplied adequately
With PPE. So the question is, what are we doing to help secure PPE for home health care workers in the state? So I'm going to broaden that question a little bit. It's not just home health care workers. It's anyone who's doing, we have a lot of services across the state that have a lot of one-on-one in-home care. It could be folks in the DD community, home health care workers, folks with the elderly, in a variety of different areas. So if any of those agencies and organizations want to request PPE from the state, they can absolutely do so. We'll get them in queue and hopefully get them what they need so they can continue. We have a lot of situations where even organizations with PPE, individuals I understand were just concerned about coming to work. They're just concerned about being infected even with the use of PPE. And that is understandable given the incredibly contagious nature of this viral spread. But we want to make sure that those organizations have what they need, and hopefully as we build our cache of PPE supplies, as we build our stockpile a little bit, if you will, and over the next few weeks before the surge comes, hopefully that'll give us a little more flexibility and them a little more flexibility as well to get their own PPE in or whatever it might be. We want to be there for the backstop, but I think the point is we want to make sure those workers feel safe and are out there because they're doing amazing work with individuals. In one way or another, we have to have it continue.
What percent estimate do you have as to when the surge will come?
The question is when the surge will actually come to New Hampshire. I think it's safe to say that the models are always moving a little bit. I think, again, correct me if I'm wrong, Dr. Chan or Commissioner Shibinette, but I think towards the end of April, first week in May is likely when we're going to see a potential peak. But the other issue I'll remind folks, it's not just a single peak and we start going down. It's not necessarily a normal distribution of the bell curve. You could have something come up and then a long tail at the end. You don't know what this back end is really going to look like. So that crest of the surge, that could last not a day but weeks. I mean, it really could be weeks. You could see a very slight decrease or even upticks for a while before you see any long-term consistency in that number dropping. You're just not sure. Given our the rural nature of New Hampshire, and I think the fact that we are getting more testing online, we'll be able to isolate more individuals that much quicker. I feel confident in saying that we hope that back end has a precipitous drop to it, but we're just not sure. I think over the next week or so, we'll see what happens in New York and Boston, some of the more high-density areas, how those models play out a little bit. And then we'll be able to transfer those models given our density and population demographics.
The President has said these next 2 weeks are going to be rough. What's your perspective on what the nation is about to go through?
Yeah, so the President's made the comment that the next couple of weeks are going to be rough. I think that's an understatement, if anything. Again, we've been in this only 1 month. We've just started to see, at least here in New Hampshire, just to speak for New Hampshire, where we are. We're kind of just hitting this real inflection point where we're going to start accelerating our numbers over the next few weeks. I don't think any of us really understand, how different it's going to look in the next few weeks and potentially the next couple months. So it's not just rough economically. It's not just rough from a population health standpoint. It's rough from a sociological standpoint, a mental health standpoint. It's rough in terms of there's nothing that isn't impacted by this. It's quite astounding, actually. It's challenging having to make a lot of decisions. I understand we're in a state of emergency, and I think our team and I have made some very, very good decisions for the state. You never know what's going to happen and what you're going to need to do. I think the roughness of it, if you will, also comes in the speed that we're seeing this. This isn't an issue where you have days and weeks to really ponder some really big decisions. You have to look at the data, you have to bring your team together, listen to the inputs, weigh the pros and cons, and you have to react. You absolutely have to. I can tell you 4 or 5 days days ago, I didn't think that we would be in a position where we're asking hotels and Airbnbs to close down. But given the large number of folks from out of state that are coming in, the concerns we heard from some of the smaller towns and up in the North Country, from folks that are owning hotels saying, please, Governor, you should really consider shutting this down. No one's really asking to stay open in that demographic, that economic demographic right now. So all those things play into, and rough is probably the right word, but it can't be overstated. It's going to be challenging times. It's going to be a complete unknown. No one really knows what this is going to look like. But again, when you have that collective community spirit, I don't mean to sound overly cliched and keep repeating it. When you stay together, you stay positive. You can make good decisions. People make bad decisions in the moment when they don't have hope for tomorrow, right? When you feel like the moment is hopeless, you tend to make very bad decisions because you're not even thinking past it. But we're making very good decisions here because people do have hope for tomorrow. Now, it's not just tomorrow or next week or 2 weeks or maybe even a couple months down the road, but we are getting out of this. And there is a positive aspect to this. We can see how strong our economy can be, so we know that it can come back. We see the strength of our healthcare system, so we know we can be there. We've seen the ability to rapidly advance the number of extra beds and capacity, so we know we can be there for our citizens. And I really think that that's giving people a collective hope, no matter how rough it gets, and it will get rough in the next couple of weeks, that we really can be there and we're going to pop out of it that much better. And that's an important aspect. That's why you have to look past just the next couple of weeks. You have to look long term and start planning for that long term as well. Start looking at that data to plan into it. Oh, I'm sorry. I'll go here if you don't mind. Thanks.
The hotel orders, does that include campgrounds?
It does not include campgrounds. You know, campgrounds are a model that we're looking at. So the question is, does a hotel order apply to campgrounds? Right now, it does not. Campgrounds are out in the open air. They're usually much further apart, and as opposed to like a hotel room or something like that. They're not overwhelmed with tons of out-of-staters. I believe the campgrounds in other states are open, so if folks are looking to quarantine or get out of their neighborhood, so to say, again, they should be staying at home. We do have a stay-at-home order in place all across New England at this point, but if they do find the need to do that, right now the campgrounds are open, and again, they just are very different dynamics, so we think there's some flexibility there, and right now we're not looking to close those. Yes, sir.
Not all the substance use is the problem. Health and Human Services working in any way with treatment providers to use technology to keep that connection with providers and people seeking treatment?
Absolutely. So the question revolves around substance use disorder and the ability for Health and Human Services to stay on top of the issue, as well as maybe even using some technology to keep that social connection and those recovery options and doors open. The answer is absolutely. Our doorway network is still open. The hub and spoke system is still very active across the entire state. We'll get a report, I believe, this week that will look at kind of the previous month's numbers. My sense is, and looking at other reports that have come out of Health and Human Services, the request for overall state Health and Human Services, the demand has gone down in almost every aspect, whether you look at domestic violence or child abuse issues, substance use. So folks are just staying at home more. It doesn't mean the issues aren't happening. If anything, when you look at the long-term trends, when you're in a very depressed economic situation, which we're about to really enter into, have already really entered into, when you look at the dynamics of what's happening around us, usually those cases go up. And so that's why we're trying to be much more aggressive with our prevention methods. Using some of the technology available, whether it's out of the doorway or some of the direct providers, I think is great. We're also looking at the ability to flex some of the limitations we previously had on how we can bill for those services, and again, hopefully open those services up to other individuals or markets of individuals. Some of the new methods of treatment and addiction and treatment and recovery within the substance use disorder spectrum that might be being tested in the private insurance market. We want to bring that to bear for the Medicaid market as well. So we're looking to see if that's possible. So we're really kind of stretching ourselves as far as we possibly can to make sure that individuals have access to services. It might be a different look. It might be under a different umbrella and a different dynamic. But I think to your point, we want to make sure that those services are there, given that there's no evidence right now that that the number of issues of substance use disorder are being reduced in the state.
Do you have a timeline on making a determination about the rest of the school year?
So the question is, do we have a timeline on making a determination on the rest of the school year? Right now, it goes through the remote learning. We'll go through May 4th. My guess is we'll make a decision sometime a week or two prior to that so that people can start planning. Again, nothing is firm, but if the peak of this crisis is likely to hit at the end of April, early May, and we don't see some precipitous downturn, it would be very tough to come out of a remote learning setting. We don't want to commit to that just yet. A lot of folks are talking about spring sports. There's still hope that we'll get spring sports going in May or even in early June. Again, we'll see where it goes in that decision, but my sense is about maybe 10 days before that May 4th deadline, we'll try to make a decision. Again, using the data we have at hand and seeing what our current situation is.
I have a question for Dr. Chen.
Sure, Doctor.
We've heard something about home test kits becoming available. What's your recommendation on that? Are those worthwhile? Should people be trying to retain those or?
Yeah, the question is about home test kits and whether we recommend that people use home test kits. There are a lot of different types of tests that are currently in development. I am not as familiar with the home test kits, so it's difficult for me to answer that question directly. But to my knowledge, they're not yet widely available. You know, I think there's a lot of different companies that are bringing on different test technology, and we're obviously watching that very closely, and we'll assess each, test and its ability to pick up the virus individually. Not all tests are necessarily the same in their ability to pick up infection, and so we have to take that into consideration when we're recommending how patients get tested. Right now, a lot of the tests that are out there from not only the public health laboratory but hospital or commercial labs all use very similar technology for detecting the COVID-19 virus. But we need to do a little more investigation into these home test kits before they can be widely recommended or rolled out, I think.
And Dr. Burks had said recently that in a recent press conference, I think she was recommending people in the real hot zone areas avoid the supermarket for a couple of weeks. Is that going to be something we see here eventually from a medical perspective, do you think?
So we certainly want people to be able to go out and get essential supplies like groceries. It's always a good idea for people to have some, week or two supply on hand, and so we still certainly encourage that. That's particularly important for people in the more vulnerable population, people that are older, people with chronic medical conditions. The recommendation is to have, at least a month's supply of medications on hand, at least a couple of weeks of groceries and other essentials on hand, and so that continues to be the recommendation. I think that what you're asking in terms of are we going to recommend that people avoid grocery stores for a couple of weeks because of the anticipated increase nationally in cases? New Hampshire isn't there yet. I think we're going to be watching the numbers very closely, and we'll obviously make a determination about whether something like that is necessary as we watch the progression in New Hampshire on a day-to-day basis. I will say, though, that I think New Hampshire has had the benefit of not only having lower population density than some other areas like New York City, for example, but we've also had the benefit of being able to see what is happening globally in other countries and even nationally in other areas of the country that have had experienced their outbreak of COVID-19 before New Hampshire began to experience ours. So Washington State, California, New York City, and so because of what we have seen both at a national and a global level, I think that we're in a we have responded relatively early and aggressively in terms of our interventions to try and slow the spread of this, and so we're just going to have to see how this plays out, how the outbreak progresses in New Hampshire over the coming couple of weeks. But hopefully we're going to be in a better position than some of these other areas around the country.
Dr. Chen, there's a group of healthcare officials, including former predecessors of yours, that are asking the governor to issue an immediate executive order to require a minimum face covering for all essential workers, and that all citizens entering populated places, such as liquor stores, grocery stores, should have to wear a face covering.
Yeah, so the question is about an executive order requiring people entering public buildings to wear a face mask, and obviously the comment on that, the comment to the executive order piece, I would leave to the governor. But I will say that there is the recommendation out there from the Centers for Disease Control and Prevention around voluntary cloth mask use when people are not able to social distance in public settings like buildings, grocery stores. So that's something we would certainly encourage. But I do want to stress again that cloth masks are one tool to helping slow the spread of this virus. And the purpose of the cloth masks is to prevent the potential for asymptomatic transmission or spread of this virus before somebody becomes symptomatic. So cloth masks are intended to protect others from the person wearing the mask in case they're shedding virus and don't know it, which we have seen. So there's that recommendation from the Centers for Disease Control and Prevention that is out there. But the primary way, again, that people are going to be able to, that we're going to be able to control the spread of this virus is through social distancing. So staying home to the extent possible, maintaining a distance of at least 6 feet between people when people are out and about. Cloth masks are a tool in this, but are not the sole way that we're going to control this virus. I will also mention that we're very obviously concerned about our healthcare agencies, not only our hospitals, but also our long-term care facilities, assisted living communities where more vulnerable populations may reside. Excuse me. It's probably worth noting that we did release a Health Alert Network message on Friday, late Friday, to all of our healthcare providers recommending that masking be used for anybody entering a facility as a way to protect our vulnerable patients and populations and healthcare providers, given the possibility and the potential for this virus to be able to be spread asymptomatically. So that is a recommendation we have put out there. The focus of that recommendation is on our healthcare facilities, hospitals, long-term care facilities, to protect specifically our more vulnerable populations and our healthcare workers. Yes, sir.
Yes, can you just take a minute and talk about the high number of negative tests? According to yesterday's count, it looks like about 91% of people who were tested are coming back negative. And we're limiting, if I'm to understand this, we're limiting the testing to people who have either traveled from the hot zones, are exposed to people who are positive, and people who have symptoms. So of all of these 7,000 people, are they false negatives? Did they have the flu and just didn't get flu shots? And are they going to be retested over some period amount of time, in another week or so or something, to make sure that they're actually negative? How does that work?
So the question is about testing and negative tests versus positive tests, and the possibility of there being false negative tests. So first off, a brief comment about testing. We have recommended from the Public Health Agency people that we believe absolutely should be tested if they're symptomatic, right? We're testing primarily asymptomatic people. And this is consistent with guidance that the CDC has put out, consistent with guidance from other states around who we believe absolutely should be tested, who should be prioritized for testing. The decision on testing other people is up to the discretion of a healthcare provider, assessing their patient based on the patient's symptoms, other medical conditions they may have, their ability to isolate at home, whether they may be more vulnerable to complications of COVID-19. So anybody that is having symptoms and concern they may have COVID-19, we encourage them and actually request that they call their healthcare provider, because the healthcare provider really is the one that's making the decision about testing. We have highlighted certain groups from the public health perspective that we believe should be tested, with the understanding that there's another large population that can be considered for testing if supplies on the ground at the local community level permit that. Your question about the accuracy, I think, your question pertains, I think, to the accuracy of the testing that's out there right now. The testing that's currently conducted is what we call a PCR-based test. It's looking for the genetic material of the virus itself, and we do that by inserting special swabs into the nasal passage to try and then detect and amplify the genetic material of the virus. Those tests, we believe, are very sensitive at picking up the virus. So if someone is showing symptoms of infection, we believe that the virus is able to be shed very early, be able to be found in the respiratory tract very, very early in the course of illness. And so the test should be sensitive at picking up infection if it's there. Now, there are many other reasons someone could have symptoms of COVID-19. There are many other viruses that are out there. Influenza is still circulating, although the levels of influenza are dropping. So not everybody with symptoms of COVID-19 will necessarily have COVID-19. But given the rapid spread and the ease with which this virus is spread, if someone is unable to get testing or a provider thinks it's most appropriate to manage somebody with symptoms at home because they're otherwise healthy, they're not seriously ill and not otherwise in need of medical attention, if someone is able to be managed at home, a provider may appropriately recommend that person not need testing but be managed at home as if they have COVID-19, and we certainly support providers in doing that.
Any other reasons of the 7,000, more than 7,000, I think out of 8,500, it seems like
So it's hard for me to speak to the exact numbers and why somebody tests negative versus positive at a population level. What I will say is that we believe when someone who's symptomatic tests negative, that indicates the person is likely not infected with COVID-19. What I can also say is that people have asked about negative testing if someone is asymptomatic, and we don't routinely recommend testing of people that don't have symptoms because testing people that don't have symptoms doesn't necessarily mean that they won't then go on to develop infection. And so, negative tests in people who are asymptomatic, meaning without symptoms, need to be interpreted with caution. But if someone is symptomatic and they have a negative test, we believe that is a pretty good indication that they likely don't have COVID-19.
I think we're going to take some from. Yeah, thank you. Thank you, Dr. Chen. I might bring you up. Great. So with that, just to give folks adequate time to ask questions, we'll take anyone on the phone that may have a question with us.
The first question comes from Kathy McCormick with Associated Press. Kathy, go ahead with your question.
Yes, thank you. Is the state hearing from any grocery stores about workers who test positive for the virus, or perhaps is the state asking grocery stores for that information? Is there any documentation on that?
So the question is the state asking or hearing from grocery stores about grocery store workers testing positive? So we have not heard directly from grocery stores on a specific amount or individuals, as most of that information would be private for that individual. What we have been doing, though, is working with not just the grocery stores, those in the supply chain, truck drivers, everybody that basically gets food and supplies from A to B to the customer. Working with the grocery store association, the Grocers Association, we asked them, and they, I think, put out a very good piece of guidance for not just customers, but for the stores themselves, looking at instituting things like sneeze guards, so there's minimal interaction between the customer and the worker themselves, protecting both on both sides of that, limiting the number of people into a store at any given moment of time, requiring social distancing and physical distancing and spacing before folks actually walk into the stores. There's a variety of guidance that they've put together to minimize the impact to both the customer and the worker. And so, again, all part of the social distancing. As Dr. Chan said, it's far and away the best tool that we have in the toolbox to minimize the spread. But no, we haven't heard specific numbers out of the grocery stores themselves, but we're very hopeful that with these new processes and procedures and guidance that they are implementing, whatever the future may hold, it'll allow us to keep that viral spread suppressed as long as possible.
Our next question comes from Paula Tracy with In-Depth. Paula, go ahead with your question.
Yes, good afternoon. I think this is a question for Commissioner Chauvinet. My question relates on the positive tests of the healthcare workers. I'd like to know a little bit more about the locations or regions in the state where that occurs. And you talk about 26% and that would be, I just wondered how that impacts people who work around them, whether they are quarantined as well. Can you give me some more information about this?
Sure. So the locations of the healthcare workers, for example, there's not one location that has had a disparate number of healthcare workers. I would say it's fair to say that in the 192 healthcare workers, you have everything from dentists to people that work in acute care hospitals, home health aides, and primary care physicians. It's all across the board. And I'd say that anytime when you look at the map of where the virus is dispersed across the state, you're going to see that there are healthcare workers in amongst those numbers. So the transmission to healthcare workers has occurred across the state like everybody else in the population. There's no one big healthcare provider that has a disproportionate amount of healthcare workers that have been affected. And so the second part of your question, could you repeat that?
Yeah. Yes, that was, if you could tell me about the percentages. You mentioned that was 26% of all healthcare workers, and I wonder how many healthcare workers there are. That seems to be a low number.
So it's 26% of our total positive cases. So there's about a little over 700 positive cases in the state. So it's 26% of that 700. So the total number of healthcare workers that have been tested and tested positive is 192.
Is there a sense, Commissioner, that how that number squares with other places?
I don't have the data in other states right now, but it's definitely an interesting data point I think that we should look at.
Our next question comes from Michael Graham with InsideSources.com. Michael, go ahead with your question.
Thank you. So, Governor, the Department of Corrections announced today that one of their employees tested positive for COVID. The screening process kept the employee out of the system or the facility. But you mentioned earlier your displeasure with the county jail releasing the domestic violence issue before. And yet, I spoke to my corrections and they said that they are reviewing cases to look at the possibility of removing state prisoners to home confinement, and they've already removed prisoners on such a at-home packet, as they call it, due to health concerns related to coronavirus. Have you spoken to Ms. Hanks about this policy? Do you have any input on it? Do you have any guidelines that you've issued? And how do you feel about people being released early from state prison as part of dealing with the coronavirus and the apparent threat, given that these one employee has tested positive?
So the question really revolves around, again, the issue of a single individual within the Department of Corrections that we know has tested positive. The pre-screening process, we think, worked fairly well in terms of minimizing that individual's contact with both prisoners and other folks within the workforce. But I think the extended question really revolves around the concept of if the cases in which individuals may be released, whether it's from state prison. We heard the stories coming out of county jail, with the county making some determination there that, again, we don't really have oversight on, and the judge. I mean, judges can do what the judges want to do and take a lot of variables into consideration when they make their determination. I have spoken to the Commissioner of Corrections, Helen Hanks. We've talked about the if, then, and what scenarios that may that we would have to look at if whether it's a worker were to become infected, and such as is the case, but we're able to remove that worker, I think, quite rapidly, or even an individual within the prison system, how that would be handled. In terms of releasing prisoners as a means of responding to the COVID crisis, we're definitely not at that point, and we hope we never get to that point. If there were ever any decisions made, the entire background of the situation would be considered. The parole board does continue to meet and do their job telephonically. So that process has been continuing. I know there was concern from some folks that the parole board wouldn't be able to meet and allow folks to move forward with their standard paroles as originally anticipated. But right now we don't anticipate any additional or at least movement on the state level in terms of releasing prisoners, anything of that nature.
Our next question comes from Abby Trombley of Monadnock Radio Group. Abby, go ahead with your question.
Hi, Governor. So last week in Vermont, bigger stores like Target were ordered to stop the in-person sale of non-essential items. Have you considered any similar measures in New Hampshire?
The question is, have we considered any measures stopping the in-person sales of non-essential items within stores, specifically within big box stores? So right now, no, we're not looking at that right now. Some of the essential retail stores that continue to operate, the vast majority of them we've seen have put up guards, they've put up protections, they have a lot of the physical distancing recommendations that similar to what you saw the grocers do to help ensure that there is minimal viral spread between any individual and a worker, or vice versa. So right now we don't feel like that's a critical need and nothing we're looking at today, and hopefully we don't get to. Great.
Car inspections,
Car inspections.
any chance those are going to be delayed?
No, right now we do get a lot of questions about if we don't have to inspect our cars anymore. No, you do have to inspect your car. There is a safety issue there as well. Inspections aren't frivolous by any means, and an inspection, unlike going to the most of the DMV services that you would typically have to go and wait at the DMV for, we've either brought online or we've delayed. A car inspection is a little different. A car inspection is more of a one-on-one transaction. There's very minimal chance of being put into a large group setting where you're sitting and waiting for your number to be called, so to say. So no, we're long and short is we're asking folks to and requiring folks to still get their car inspected on time. I know that folks would be hoping would delay it, but there is a safety issue there as well. And given that we don't see that as a major contributor to a high impact viral spread or large conglomeration of individuals gathering in groups of more than 5 or 10 people, nothing of that nature. So we expect those to go on.
Governor, is there a penalty set up if anyone's hotel or Airbnb doesn't follow this order?
So the question is, are there penalties set up for hotels or Airbnbs that are not obliging to the order? I don't think we've set up a penalty system as of yet. The vast majority of folks are way down in business if they haven't closed already. Like I said, we didn't hear from anybody asking to not do this. Frankly, we actually heard some owners saying that we absolutely should do this and instill this. And so again, we took all those factors into consideration. So we don't anticipate there being a problem. But again, I think a lot of folks across the Granite State in this country right now understand these are unprecedented times. They require completely new models of normalcy, both personally, with your business, with your family, with education, whatever it might be. And they're taking it very, very seriously. And so we don't anticipate there being an issue, but if there were, we'll take them on an individual basis. Okay, well, thank you for everyone for joining us. Like we always say, we still have a long way to go here. We have some tough weeks ahead. Nothing we can't handle and nothing we can't get through as a state. So thank you guys very much. Be safe and be well. Thank you.